What does leg pain or tingling sensation mean in regards to diabetes?
Okay, there are two different questions. Leg pain is different and tingling is different. Yeah. There are two different things. One is leg pain. Actually, we should know what is diabetes. Diabetes is of two types, type 1 and type 2. In type 1, insulin is not forming in the pancreas. In type 2, insulin is there, but it is not functioning properly. Okay. And function of insulin is to penetrate the glucose inside the muscle. So if there is less insulin or insulin is not functioning properly, glucose will not be available to the muscles and fat. So if you run, then your leg muscle will cramp because you are not getting enough food. So although there is lot of sugar inside the blood, but no sugar in the muscles. So leg cramp or leg pain will be there. And if hyperglycemia remain consistent for so many years, then there are complications like neuropathy. That neuropathy will cause tingling and numbness in the leg. So one is due to hyperglycemia, other is due to complication. It is microvascular complication of diabetes. If there is long-standing hyperglycemia, then patients from tingling and numbness. It is the sign of peripheral neuropathy in diabetes, which causes tingling and numbness.
What are the good travel foods for diabetic patients?
Not only for diabetes, for everyone, good travel foods are always fruits and vegetables. Fruits and vegetables, fresh fruit and vegetables are always good for travel food. Because if we take junk food, it is not only for diabetic, for any metabolic syndrome, they are dangerous. So we try to take as much as fresh food and try to use less of hurry, worry and curry. It is we should not hurry, we should not take much curry, and we should not worry. Okay, these three things are dangerous for everyone. So we should try less of the curry and all these things and more of the fresh vegetable and fruits.
Does menstruation affect blood sugar levels?
In menstruation, it is only 40 or 30 ml of blood which is lost. So it does not have any significant effect on the diabetes. It is a sort of myth that menstruation decreases hemoglobin, it decreases blood sugar. It is not like this.
Can a diabetic patient donate blood?
Yes, they can donate blood. There is no problem in donating blood because if they have controlled blood sugar, then there is absolutely no problem in donation of blood.
Can diet or exercise really prevent diabetes?
Yes, of course. I told you that there are two types of ailment. One is manufactured in our body itself. We manufacture the disease. Sometimes diabetes can be hereditary and metabolic, but our lifestyle is the main problem. We take on this eating junk food, and there should be a minimum gap of 4 to 5 hours between sleep and this dinner. So if we follow these rules, then we can prevent diabetes. And if we suffer from diabetes, it can be reversed by good lifestyle and of course some medicine like metformin.
What are the signs that a body gives before it develops diabetes?
If they understand that before diabetes, a decade earlier than diabetes, there is called the insulin resistance, a condition in the body which is called as insulin resistance, in which there are more insulin but they are not working properly. After insulin resistance comes diabetes. So if we prevent insulin resistance, diabetes can be prevented in our body. Now you will say how insulin resistance is created. Actually, this is the abdominal fat. Suppose if 100 kg body, but he is having not abdominal fat, he will not have diabetes. But if 40 kg man have more of visceral fat, it can cause diabetes. It is the visceral fat. It is the fat in the belly which is causing insulin resistance. And insulin resistance causes diabetes mellitus. So if they prevent abdominal belly to reduce, or if they have conscious about this waist circumference, then of course it will prevent diabetes.
What are the sexual problems caused by diabetes? How can one deal with them?
Into day-to-day life, there is a lot of erectile dysfunction problem. Patients try to discuss with the doctor, but when we ask, then they say yes, it is a problem everywhere. Actually, endothelial damage, it is first presented by erectile dysfunction. When endothelial is damaged in diabetes, it is presented in patient like a erectile dysfunction, and they don't know that this is because of diabetes. So if their sugar is not controlled, endothelial will damage and it will present like ED. So in that case, we have to be focused about this glycemic control. If they have good glycemic control, this complication can be prevented.